side as we approach another foaling season here at the stables. If your mare has made it through her 11 months of pregnancy, you're pretty much on the home stretch. Labor and delivery are generally uncomplicated, but things can go sideways. So every effort should be made to be present during foaling for your mare. If you don't have any experience yourself foaling out a mare, it is advisable to hire a foaling attendant or ship your mare to a farm that has experience with foaling out mares. Definitely installing a video system so that you can watch them through cameras. You can also get a full alert system, which could potentially save the mare and the foal's life should an issue arise. It is also advisable to have your veterinarian's telephone number nearby in the case of an emergency. So we're going to start talking about labor. So labor stage 1 is all about positioning the foal. During this stage, the foal rotates from being on its back to extending its head and feet into the birth canal. During this time, the mare can appear restless. She may pace her stall or pacing back and forth along the fence line, usually by a gate. They might flank watch, so they might turn their head around and kind of nip at their sides, maybe kick at their belly. They usually start to sweat a little bit. This process can last several hours. Mares should definitely be monitored from a distance during stage 1. We don't want to interrupt her. We don't want to cause any extra stress to her. The end of the stage 1 is marked by the rupturing of the membranes and the release of the fetal fluid. This usually happens 1 to 4 hours after stage 1 has started. Stage 2 of labor is the expulsion of the foal. So after active contractions will follow the passing of the fluid. Once the mare's water has broken, the mare may continue to stand or lay down during this time. It all depends on her and what she feels most comfortable with. A white membrane, which is your amniotic sac, should protrude from the vulva. The foal should be positioned with one foot in front of the other, with the toes pointing down. The feet are shortly followed by the nose and head resting between the knees. Once the head is free, the mare will commence with some very forceful contractions to help the shoulders through the pelvic canal. The rest of the foal will be delivered very quickly at this point. Some clinical signs that require emergency veterinary care. If you notice lack of progress, so at any stage lasts longer than normal. If a red bag is presented instead of the pearly white amnion, this is a red bag delivery and an emergency. The sac needs to be cut immediately and the foal needs to get out of there pronto. If the foal is in an abnormal position, so if one leg is back, there's no head present, you have back feet instead of front feet, this is all concerning. Any evidence of hemorrhaging from the mare, so some bleeding is normal in the birthing process, but if you're noticing that the mare is bleeding excessively, this is definitely a concern that your vet should be contacted immediately. And then, of course, as we kind of talk more about stage 3, if any parts of the placenta are not expelled after 3 hours, this is a medical emergency. So during labor, we kind of go with this 10, 20, 30 rule. This is kind of what our barn does, just to ensure that we are doing everything that needs to be done to ensure that the mare and foal are both healthy and safe. So 10 minutes, if the mare is not making progress at this point, position assessment needs to be done on the foal. So we need to manually check to make sure that both feet are present and that the nose is coming shortly after. If not, we may need to help adjust the foal at this point. By 20 minutes, if the foal is not born, you need to start pulling, or if you notice any issues that the mare is not progressing, she's struggling with the labor at all. Sometimes they'll fatigue and tire. So at this point, you definitely need to get in there and start pulling. You only pull when she's contracting, and you always pull down towards the mare's hocks. If 30 minutes, the foal has not made its way into the world, then plain and simple, if the foal doesn't come out, the mare is going to die. For the foal, this is also bad because the delay in delivery can result in hypoxia or lack of oxygen. So you need to get that foal out pronto. So you need to, elicit a friend to kind of help pull the foal out, get some ropes, chains if you need to, and get that foal out of there. We always want to be careful when we're pulling, but at this point it's an emergency and the foal needs to get out. So you gotta do what you can to get the foal out of there. If the foal is born and not moving, you need to call your veterinarian immediately. Of course, this is an emergency. Labor stage 3 is the passing of the membranes. So the mare will normally pass the membranes within 30 minutes of foaling, although some mares may take up to 3 to 4 hours to expel the membranes. The mare may show some discomfort as the uterus contracts to assist with the removal of the membrane. So sometimes she can almost act like she's in labor again. She might get a little anxious, pawing, kicking at her belly, biting at her sides. This is all normal, but if you notice that your mare is in distress, she may need some pain management. Under no conditions should the membranes be pulled from the mare. If the membranes aren't passed within 4 to 6 hours, then a veterinarian should be called. We usually do no longer than 3 because we want to be proactive. Retained membranes in the brood mare can have serious consequences, including uterine infection and laminitis in your mare. You should always keep your placenta once it's out of the mare and check it over. If you aren't comfortable with doing this, then you can have your veterinarian check it when they come to do the full exam. So always remember to check it and not chuck it. And this is a little diagram here that just kind of breaks down the different parts of the placenta. So when you're examining it, you want to make sure everything is present and normal. Any discoloration of the placenta can mean that there's a potential infection present. If there's pieces of the placenta that are missing, then that's a concern because they're still inside the mare and they're going to need to come out or they're going to cause an infection there. And then we kind of do a 1, 2, 3 rule. So once the foal is on the ground, we want 1 hour to standing. So the foal should be sternal within 1 to 5 minutes, but we want them on their feet by 1 hour old. By 2 hours, we want them nursing, and we want them nursing consistently. So not just one drink and done. They should be nursing a couple times every hour. 3 hours, the mare should have passed her placenta. Again, if she has not, this is a medical emergency. So we're going to kind of talk about a little post-foaling checklist and kind of go through all the important timelines that we note when we are foaling out our mares. So again, the foal should be sternal within 1 to 5 minutes. If not, you should put the foal up on its belly, and you may need to help get some fluid out of its lungs at this point. The foal should be standing within 1 to 2 hours. Again, the sooner they're standing, the better, more likely they're going to start nursing. Some foals may take longer to stand, especially large foals. We find that it takes a while for their tendons and ligaments in their legs to relax because they've been cramped up in utero for so long. So it's not abnormal for them to take a little longer to get to their feet. We try not to assist them to standing because you can do more harm than good. If their legs are still quite contracted, you could injure their tendons and ligaments, which definitely isn't good for the long-term health of the foal. The foal should be nursing within 2 to 3 hours, so we like them nursing as close as we can to that 2-hour mark. If we need to, if they're struggling getting a latch, sometimes the mare's udder conformation restricts the foal from getting a good angle. Sometimes the foals aren't very smart and they struggle getting that right angle themselves. Then we will milk the mare and feed the foal that way to make sure that they are getting that colostrum right away. The colostrum or the first milk is, again, critical to these foals because it provides important antibiotics. Foals should drink about 2 liters in the first 24 hours, which is going to help with gut closure. If the foal does not get enough colostrum, the foal can become septic when bacteria enters the bloodstream and can die from this. So again, it's very important to make sure that your foal is actually latched on. Sometimes you'll hear a sucking noise because they're sucking on the side of the udder or the leg, but unless you see them actively drinking and swallowing, then don't assume that your foal is nursing. Other timelines that are important is your foal should pass their meconium, which is their first manure, between 4 and 6 hours. An enema may be given in the first few hours of life to assist with the meconium passage. If you notice your foal is straining at all, you want to give an enema. They can cause themselves a lot of pain. They can cause themselves other issues if you don't help them get that manure out of their system. Some breeders, just as a standard, will give them an enema immediately after birth just to help that pass. We have found over the years we are doing it more frequently with our foals just to make sure that they've got that comfort and that they're not focused on passing that meconium when they should be focused on other timelines such as standing or nursing. Your foal should urinate within 9 to 10 hours. Oftentimes we'll see our foals urinate just a little bit when they're passing their first meconium, especially if they're straining at all. They will have a little bit of urination then. Again, give them an enema if you're noticing any straining at all. You want to make sure you check the foal's IgG level in the first 8 to 24 hours after birth. This is going to ensure that your foal has gotten enough colostrum in their system so that they are protected. Your veterinarian can do this. Some people will do this at home if you're comfortable doing a blood draw from the jugular, but most of the time a vet will perform this for you. We're going to talk a little bit about umbilical care. So we use a betadine solution. We dip the navel 2 to 3 times a day for the first day, and then we continue to dip until the umbilical stump is dry. We use betadine because it's very mild on the skin. It doesn't cause any burning or irritation. You want to continue to check the umbilical stalk daily for any kind of discharge. If it's wet and seepy, if there's any dripping from it, these are all concerns that you should notify your veterinarian of. Again, if there's any bleeding or any smell from it, again, these are all concerns that you should have your vet check them out. We had a experience last year where we had our first bladder defect. So the foal was actually, when she would strain to urinate, she was having urine leak out of her umbilical stump. So we had to get our vet out to check that. She cleared up and everything was good, but we had to do a little bit more intensive care to make sure that it wasn't going to be an ongoing issue. We also want to make sure we do a postpartum mare check. So we, again, make sure that the placenta is passed, ideally within 3 hours of birth. Again, save all the placenta parts to look for any abnormalities, and remember to keep it away from other animals. You got to check the mare's udder to make sure that she's producing milk. You're going to check the mare's vulva for any kind of trauma. You're looking for bruising, tears, discharge. They do heal very quick, but they can also get infections. So it's good to make sure that they're nice and clean back there. Again, you can clean their vulva with the betadine solution that you can use to dip the foal's navel, and just kind of keep an eye on it over the next few days just to make sure that nothing is getting nasty or irritated back there. And continue to monitor your mare's appetite, their temperature, and manure output. Some mares, if they're cramping at all, they might not eat a lot and then they start to get colicky. So again, this is all a concern, and your veterinarian should be notified. Now we're going to talk about some newborn foal normals. So their temperature should be between 37.2 Celsius to 38.8 Celsius, or 99 to 102 Fahrenheit. Their heart rate is usually between 80 to 120 beats per minute. Their respiratory rate is usually 20 to 40 intakes per minute, and then they should have pink gums. They should be nursing 4 to 6 times per hour. Their fecal output should be 2 to 5 piles per day, and it's usually a very pasty, sticky yellow substance. Sometimes you don't see it. Some mares are really good at cleaning up on their foals. Other times, it just gets mixed in the bedding and it's hard to find, but definitely keep an eye on it. Make sure that your foal is putting out manure. So some clinical signs that require emergency veterinary care with your foal would be meconium impaction. So this is if they're straining at all to pass manure, if they're weak and cold, if their IgG is low. This means that they've got low antibodies in their system and they're not going to be protected. If your foal is running a fever, if you notice any discharge from the nose, they have diarrhea, they're showing signs of colic, they're showing any kind of strange behavior, like maybe not interested in the mare, bumping into walls, that kind of thing. If they're not nursing like they should be, if their gums are yellow, blue, or gray, so we want nice pink gums. We don't want them to be any other color. If their eyes are sunken in, or if they have an entropion eye, which is a folding of the eyelid, contracted tendons where their legs are really tight and they're usually kind of standing up on their tiptoes, or if they have relaxed tendons, which is the opposite issue, where they're basically really dropped down and on their fetlocks. Any severe deformities in their legs or their body, swollen joints, or if your foal shows any signs of lameness. These are all things that your veterinarian should be contacted for immediately, and you should have the foal checked over. So we always do a post-foaling vet check. So we always have the mare and foal examined by our veterinarian, usually around 24 hours after foaling. This is greatly encouraged because this examination can detect any problems with the mare. It allows evaluation of the placenta, and it provides a comprehensive evaluation of the foal. Such problems that might be detected in these exams would be, any limb deviations, septicemia, any rib fractures in the foal, and of course, a thorough check should be done on your mare if you're planning on breeding her back, because her current state after foaling might impact her future breeding potential. And then, of course, there's always the risk that she could have a uterine infection or even a vulva infection from any tearing of the skin. We continue to observe our foals after they're born. There's lots of things you need to keep eyes on, so it's always good to monitor your foals, especially for that first week, because a lot can go wrong in a very short period of time. So we always want to make sure, again, we're checking that umbilical. It should be dry after the first day. If urine is ever seen dripping from the umbilical stump, then we might need to have a surgery done to prevent that. Because this is a route of infection into your foal, and it can be very, very bad for them. So don't just dismiss it. You want to get it checked out right away. Because the foal is very susceptible to an infection in the bloodstream. The first sign of this is usually reduced activity or decreased nursing from the mare. So you might notice your mare starts to stream milk, and this is usually because the foal isn't relieving the pressure and drinking like they should. Any signs of lethargy or reluctance to get up and nurse or unusual behavior should be investigated. Infection can settle in the foal's joints and may cause lameness. So if you notice they're swollen or they're lifting up a leg or anything like that, these are all signs of concern. Hernias can also develop around the umbilicus. They are generally non-painful and reductible, but may require correction. So colt foals may also have a hernia seen with some swelling in the groin area. So here's just a picture of a little hernia there right around the umbilical stump, which did need surgery later on to correct. Foals can also be born with weak or bent legs. The tendons and ligaments of the legs can often be too slack or too tight, or if there's uneven growth of the bone. But both of these tend to improve dramatically within the first 2 weeks. It is always something that you should get checked out, because if it is left untreated, it could cause lifelong damage to your foal's joints and bones. So this colt here, we noticed that he was really narrow through the chest, which was causing a bit of a leg deformity. So he was kind of like knock-kneed. So with the support of kinesiology taping, as well as some exercises, we were able to help this foal straighten out and develop quite normally. If you don't do these things, sometimes, they might resolve on their own, but there's usually consequences that we might not notice until they're 2, 3, 4, 5 years down the road, when you're starting to ride them, because they've developed issues in their joints from this early onset of deformities, which again lead to imbalances and extra strain and tension on their young growing legs. So it's definitely a concern and should be addressed as quickly as possible. So in closing, most mares will deliver normally and present their owners with these lovely, healthy foals. Before that can happen, it is vitally important to be prepared and discuss options. Make decisions with your veterinarian so that you can implement an emergency plan. Again, if you are not experienced in foaling out mares, you should not do this at home on your own. You could lose your mare, you could lose the foal. It's just not recommended. You should send your mare to a foaling facility where they can look after your mare's well-being. They know what to do if an emergency happens. They've had experience with these sort of things. They know what's normal and what's not normal. A lot of times owners just kind of maybe don't observe as, good as trained professionals do, or they just don't know what's normal and what's not, or when to intervene and when not. So when in doubt, get the vet out, but definitely monitor very closely your mare's health as well as the foal's health, and get help from people that have done this. This is definitely going to increase your chances of ensuring the health and welfare of both mare and foal if complications occur. Thanks for watching. I hope you kind of enjoyed this brief video on foaling. I hope to do some more over the next few weeks, just a little bit more information on the process that we do here at the stables. If there's any specific questions you have, I can also do a kind of a Q&A version of this as well. So I hope you enjoyed watching it, and soon we will have our mares up on the live stream. Enjoy.